All right. Good morning. Good morning. Good morning. As usual, it's a lovely Tuesday morning on Niger Health Radio, your wellness companion. This is the Health Convos show. As usual, we talk and discuss about health, health, health. And as usual, my name is Ogo. I still remain the one and only Ogo. And I have with me on the show Dr. Olatunmu Adeola.
Yeah, good morning, everybody.
Good morning, Dr. Adeola, and welcome to the show once again.
Thank you.
So, Dr. Adeola is the head prevention care and quality improvement services of Equitable Health Access Initiative. She's also a medical doctor. And Dr. Adeola, tell us more about yourself.
Okay. So I'm Olatunmu Adeola. Like you mentioned, I'm a medical doctor. I'm married. I have a fantastic. I have two lovely girls as well. I like reading books, and I write too. Let's leave it at that.
So you're a writer?
Kind of, yeah. You can call me that.
So you heard her. You heard Dr. Adeola. She's a mother. Okay, no, she's a wife.
Wifey.
She's a mother. She's a writer. Just only her. She's not even sharing anything. Only her. Well done, Dr. Adeola.
Thank you.
Once again, it's good to have you on the show. We've really missed you.
Yeah,
We've been missing for a while.
Yeah, just 1 week.
That just 1 week is looking like
it's a lot.
I know,
It's
right?
a lot.
All right. So on today's topic on the Health Convo, we'll be talking about family planning. Dr. Adeola here will tell us a whole lot about what we need to know about family planning. Family planning is very important. So let's listen as she dissects and tell us all we need to know about family planning. So Dr. Adeola, what is family planning?
Yeah, family planning, according to the World Health Organization, is the ability of individuals and couples to attain and anticipate the number of children they want to have, the timing and the spacing of those children. To attain and anticipate the number of children they want to have, the timing and the spacing. And it can be achieved through two means: by contraception and by reducing infertility.
So who should get on family planning? So most times the pressure is on women. You know, the pressure is on women. You hear people asking, have you gone for family planning? Maybe when they have
Who asked the men?
Nobody. The person does not go.
Do they ask each other?
It's only the
person. Are you on family planning? They don't ask each other.
It's always the women that request. So I'm wondering, who should get on family planning? So it's just the women.
Irrespective of gender, I think any individual or couple that has a family or is anticipating to have a family soon should actually get on family planning. I mean, I'm aware of individuals that actually start anticipating and thinking of family planning even before marriage. You know, they start thinking about it. So of course, it's not based on gender. It could be the man, it could be the woman. It should be both of them in the process together. And for anybody that is planning to start a family, then you should get on family planning.
Yeah, I think it's high time, we begin to create awareness, that, look, when we say family planning, it's not just about the women.
No, it's not.
The men too. Yeah. They have a role.
And I hope we'll get to that today.
I hope so. Well, I trust you'll do that. So what does family planning do exactly? We hear the word family planning. Yeah. Are you on family planning? Have you done family planning? Are you thinking about what exactly
does
family planning do?
Of course, from the definition, we said it helps you to determine the number of children you want to have, the timing and the spacing. So the first thing that family planning does is that it prevents unwanted pregnancy. Okay. I hope we'll get into that later. There's a difference between unwanted pregnancy and mistimed pregnancy. family planning actually prevents both. So unwanted pregnancy is you don't even want this pregnancy
At all.
Sometimes the pregnancy may be wanted, it may just be coming at a wrong, not wrong time, at not the wanted time. You understand?
Okay.
So maybe I want a child this year,
Mm.
and the child in December, and the child decides to come in January. Is not unwanted in that sense. It's just mistimed.
Okay.
It's coming earlier than I wanted it. So family planning actually prevents unwanted pregnancy and mistimed pregnancy. It also reduces infertility, because, we have this notion that family planning is all about preventing pregnancy, preventing pregnancy. But the truth is, family planning is about preventing pregnancy and also ensuring pregnancy happens.
Really?
For those who want it.
Oh.
So if a family if a couple plans to have a child, for example, this year, they can start doing some things to make sure that pregnancy happens that year. It's all part of family planning. So it's not just for those who already don't want more or are not yet ready to have children, but it's also for those who want to have children and do not have. So family planning also reduces infertility in couples that want to have children. Yes, because for many couples, they want to. They are just imagining that we will have children, but they don't do anything to work towards it. Okay? They don't get advice. Like the woman that doesn't want to have a child is going and saying, "How can I prevent pregnancy?" The woman that wants to have a child can also go, or the man that wants to have a child can also go and say, "What can I do? We want to have our first baby within the first 2 years of our marriage. Let's work towards it." That's family planning.
That's family planning.
Yeah.
That's family planning. Interesting. Interesting. So are there methods?
Method plenty.
Please tell us. Tell us. We are ready.
So there are many family planning methods, and I'll just try and group them.
Okay.
So that there won't be too many, and so that we can remember them. So we have what we call the long-acting reversible contraception.
Long-acting reversible contraception.
It could be through implants.
Okay.
Or intrauterine device. The implants are like chips that are inserted into maybe the woman's skin, under the woman's skin. Yeah, that contain substances that will prevent pregnancy.
Wow.
The intrauterine devices are usually inserted into through the woman's vagina.
Okay.
And they stay in the uterus.
Okay.
And they prevent pregnancy as well. So that's one group. We have the hormonal contraceptions. These ones could be in terms of pills. Or injections. I think they are very common. Yeah, people are aware. So there are hormones that are given to women that prevent pregnancy in them. So they could be swallowed as pills, or they could be taken as injections. We have the barrier method. And this barrier method could be used by either the man or the woman.
I've been waiting to hear condoms. Something that has to do with men.
We have condoms. And for the condom, luckily, we have the male condom and the female condom. I'm aware that we are more aware of the male condom.
Yes.
But the female condoms actually exist. It hasn't gained as much traction and acceptance as the male condom. And I think many organizations are actually working to make it more acceptable, more friendly, and improve the sexual experience of those who use it. I know that over the years, female condoms have been improved upon. So we have the female condoms. We also have what we call the diaphragms and the caps, also worn by women. Yeah. So what they do is that they serve as a barrier, preventing the sperm. They are the only methods to actually prevent the sperm from getting to the woman. Okay, they prevent the sperm from getting to the woman. Then we have the fertility awareness methods. There are methods that, like we said, family planning is not just about preventing pregnancy. It's also about making pregnancy happen. So the fertility awareness methods are methods that women and men use to prevent pregnancy by timing the ovulation or the fertile period of the woman. So the woman is aware of when she's fertile. You know, the woman can get pregnant at any time during the month.
Sure.
During the menstrual cycle.
Yes.
It's only within a period of time, maybe 5 days thereabout, that the woman can actually get pregnant. Yes. So that fertility awareness method helps the couple to prevent pregnancy and also to get pregnant. You know, so many women, all they need to know is, this is the time I can get pregnant, and boom, the pregnancy comes. So that's, and then we have permanent contraception. Remember the first one I said, they are the long-acting, reversible contraception. Yes. Then we have the permanent contraception.
This one is
and good enough. We have both for men and women. Okay. So, you know,
good news. Good news.
So we have tubal ligation for the women. The tubes, the fallopian tubes in the women are snitched, kind of. Okay. And then we have vasectomy for the men. Some tubes in the men too are snipped as well. Those are the permanent contraceptive methods that we have, and we have for both genders.
Oh, interesting. Permit me to ask Dr. Adeola on these methods. Has research or statistics shown that they failed at any point in time?
I like that question. For most of the methods I've mentioned, we have 99 to 99.9 success rates in preventing pregnancy. I would say that the methods that have the least success rates between 95, 97 are the fertility awareness methods.
Okay.
Yes, those ones were like withdrawal methods. You know, when the man withdraws before ejaculating, and then when abstinence too, that one they feel very well. You know, abstinence too fails, and then timing method. You know, trying to avoid sex during the ovulation period. Those ones have between 95 to 98 success rates. But for the most of the methods, the long-acting reversible contraceptions, the pills, the injections, they have success rates of about 99%. The permanent contraception has success rate of 99.9. So there is a 0.1% chance. So perhaps maybe 1 in 1,000 of it's not. I mean, and for all these methods, the chances of success increases when they are done consistently and correctly. It must be consistent and it must be correct. So if there is no consistency and if not done correctly, then the chances of it working based on statistics reduces.
Beautiful. Yeah. Beautiful. Thank you, Dr. Adeola. We will be going on a short musical break. When we return, we'll continue to talk about family planning. We'll be having Simi Duduke by Simi. Enjoy. I know you love that. I know, yeah, I know. Funny enough,
I don't know all the lyrics of this song.
I know the part. It's okay.
I pray for the day when I can finally kiss you. You know, say every day I pray for you. Oh, in my heart, there's a permanent place for you. That's why my heart is a big I do beg. Cause now you are chosen. I am very, I am fair. I sing for you and I be like.
Ayọ̀fẹ́mi, Ayọ̀fẹ́. Thank you, Simi. We enjoyed that.
We sure did.
We sure did. In fact, that's a very lovely song by Simi. Welcome back to the show. And in case you're just joining us, we are on the Health Convo show on Niger Health Radio, your wellness companion. We've been talking about family planning before we went on a short musical break. We are back to continue. And oh yes, you haven't missed much because you can always go back to our Instagram page on Niger Health Radio and also on our YouTube channel to watch this conversation. Back to our conversation, Dr. Adeola. And I am Ogo. I have Dr. Adeola with me. So, we've been talking about family planning. You've talked so much about, you've told us about the methods. You've made us to understand that both men and women, should go for family planning. You've also made us to understand that family planning is not only to prevent pregnancy, it's also to prepare the couple, for pregnancy. Now, what are the things to consider when picking a family planning method?
Okay. I would like to say that your family planning decision, it's not something that you decide on alone, because it takes more than one person to plan a family. So many young ladies are already planning their families outside of their partner or their spouses. The same for some guys, So it's something that should be planned together.
Okay.
And I would say that you should also let your medical practitioner also be part of your planning, so that they will be able to give you options that are best for you as a couple. Yeah. So just saying that in the background, some of the things that could inform what is best for you is you.
Wow.
That's the first thing. The kind of person you are.
You are.
Now, for all the family planning methods, we have some you use every day, like the pills. We have some injections you take every month or every 3 months. We have some you insert for 3-5 years, you forget about it. And then you have the permanent ones. So you are the first thing to consider. Are you a very organized person?
Okay.
Are you someone that when you have malaria, you are very sick, almost dying, you forget, you skip like 2 out of the 6 doses? If you are that kind of person, very busy, not so organized, you may want to avoid family planning methods that will require you remembering to take them every day. Okay, so that's something about you. I'm also looking at you, your age. So how old are you? It could also inform the kind of family planning method you would like to adopt. Maybe you are very young, or for example, if a 50-year-old woman or a 40-something-year-old woman is having her first child at 45, she may want to consider a family planning method that would allow her to quickly have another child when she stops the method, So the age is important. Then, do you plan to have more children? Okay. Or you don't want to have children again. For example, if you don't want to have children again, then you can go for tubal ligation. There are very few Nigerians that go for permanent contraception. People are just afraid. What if? Even after having 10 children. They are still thinking of what if. For many reasons. We have many reasons. What if my husband just said that if I don't have another child, you go and marry somebody else? Or what if all the children die? We think of all kinds of things. So if you want to have more children, you may want to avoid permanent contraception. If you are also very young, you may also want to avoid permanent contraception as well. You may also want to look at your income, It may also help you. Your lifestyle is very important. If you smoke, there are some contraceptives you are advised to avoid. If you are someone that has multiple sexual partners, and the likelihood of sexually transmitted infection is high. You may also want some, and then medical conditions. People who have cancers, who are on some type of medications, people who have diabetes, people who are obese, who are on medications that may interact with the contraceptive methods. Those could also determine the kind of contraceptive. Like you can see, it's an interplay of many things. Your medical condition, your partner, your plan as a family. So all of them put together will help you to decide which family planning method is best.
Interesting. Yeah. We have a question here on our Instagram page. Sunshine White. Okay. He has a question. He said, aside from use of condoms and vasectomy by men, do we have pills or chips that can be introduced in a man's body as contraceptives, as the case is with women?
I feel you. Really, I mean, you can see a guy that is probably thinking of. I know many guys don't like condoms because they say the feel is not like skin to skin. Natural. It's not natural. And I also know that men are scared of vasectomy. That's that thing. And let me just say quickly that vasectomy will not affect ejaculation. It will not affect erection. It will not affect orgasm. It will not affect sexual drive. So vasectomy is not going to touch your sexual life as a guy. The only thing is that it's going to prevent you from getting a woman pregnant. So do we have chips? Do we have patches or pills for men? For now, we don't. Never say never in science. It is possible that tomorrow somebody comes up. But Sunshine, I'm sorry. We don't have chips.
So I hope that answered your question, Sunshine. And of course, thank you for asking that question. Moving on to the next question, Dr. Adeola. What are the factors affecting women's responses to family planning? You see a lot of women, they are like, oh, am I sure I want to do family planning? Is it that they are not informed? They don't have the right information about this?
So we have social, we have cultural, we have religious factors. Statistics shows that out of 214 million women in developing countries who want to avoid pregnancy, 214 million of women who want to avoid pregnancy are not on contraceptives. Okay. They want to avoid pregnancy.
But
over 200 million, but they are not on contraceptives. We have religious reasons. Okay. There are some religious groups, denominations that do not believe in contraceptives. So we have also cultural reasons. Some people in their religion, they believe that they will have children until God doesn't want to give them children.
Yes.
Then we have myths too. Yeah. That if you use a contraceptive method, you may not have children again. So some people are afraid that if I use it, what if when I want to have, I'm not able to have children again? So these are some of the reasons. The family too. Sometimes the husband doesn't want. Okay. Some people are afraid of the side effects. I know we'll get into that. Some women are afraid if I use it, I may gain weight, sexual drive may be affected. These are some of the reasons.
So let's go to the common side effects of family planning.
Okay, so the common side effects are common. Nausea, vomiting, weight gain. Weight gain is one that women are usually skeptical about. That could be bleeding or spotting in between periods. You could have mood swings. And for some few women, there could be delay in having another child, or there could be change in menstrual flow. And women, they want to see their period when their period should come. So those are some of the common side effects associated with contraceptives.
How about men?
Any side vasectomy, yes. Usually, of course, there is pain after the procedure. Okay. It's a simple procedure. 30 minutes. Okay. You are not going to be admitted.
You just walk out.
So there could be pain post the procedure, and then some 1% thereabout have pain even for a longer period of time after.
Okay, so what are the chances of a woman to get pregnant while on family planning?
Very low. It's just the reverse of what we discussed the first time. So the chances are very low.
Because some women are on family planning.
I mentioned something. Consistency and correct use. So if
It's
they are used
possible.
consistently and correctly, the chances are less than 1%.
Yeah.
They are less
So
than
it's
1%.
possible they did something. They
Yes,
didn't do
you
something
forgot.
right.
Yeah, if
which
you
led
didn't do
to the
something right, that actually
pregnancy.
led to the pregnancy.
Okay, so the last question before we sign out. I know you've mentioned this, but just what are the family planning methods?
So we will say it again, men, guys.
So that they will know.
Family planning methods for you. You can use male condoms and you can have vasectomy. I beg, guys, don't forget. So when you go to the clinic and you're asking, doctor, what family planning method can we use? Remember to ask about condom and vasectomy so that you can actually pick it. Let's be guys. Let's take the lead. Let's take the lead.
End of story. Dr. Adeola has said it all.
The guys take the lead.
Uncles, daddies,
Head
brothers, male cousins. You have heard
what
it.
A woman can do, a man can do better.
The time has come. Family planning is here. It's for men and women. Now we have learned a lot. Thank you for listening. Thank you for watching us. I'm sure you have no regrets watching and listening to this interesting topic where Dr. Adeola talks to us about family planning. I personally have learned a lot on today's topic. Thank you for watching us. We still remain Naija Health Radio, your wellness companion. Don't touch that dial. We still have more interesting content on this station. Have a nice day. Bye.
Bye.